Hey, welcome back. This is webinar number 2, and today we're going to be talking about the Nutritional Therapy Foundation diet. So when it comes to diet or food, I like to talk about this subject because, in case you don't know already, I like food. I am not one of those people who has a problem getting enough calories in. I'm one of those people that has the problem of always wanting to eat. I've always liked food. I like healthy food and not so healthy food. I love a beautiful green salad on a warm day, or a delicious piece of pumpkin pie on Thanksgiving or my birthday, or basically pumpkin pie sounds good any day of the week. But food didn't become my medicine or become medicine for me until after my own health crisis. In the first webinar of this series, you heard my story, so I'm not going to go into more details about that here, other than to say that my health took a downward turn in 2008, and it went downhill pretty fast as I suffered from chronic bacterial infections, which led to a massive overuse of antibiotics, resulting in a messed up body, mind, and spirit. Ultimately, it created a superbug in my gut. I was diagnosed with SIBO, small intestinal bacterial overgrowth, and lots of other health problems, including Hashimoto's, that I had to work through and figure out how to heal myself from. I found out quickly that Western medicine or antibiotics and pharmaceuticals were not the answer for me, and through a lot of study and research, I found my own answers in food or diet and lifestyle changes. This was the first area that I was forced to address when I walked away from the doctor's office and started figuring out ways to heal myself from a root cause perspective and not on simply trying to suppress my current symptoms. The first protocol I found was a protocol for balancing the gut bacteria and killing parasites and bugs in the stomach and digestive tract. It sounded good, so I went for it. This was the first time that I had ever eliminated processed foods from my diet, and I began to learn a ton about food and nutrition and how it affects the body. I would eat clean, healthy sources of proteins, carbohydrates, and fats. I increased my water intake, took the supplements as recommended, and even did several 4-day juice fasts. And again, this was the first time in my entire life, you guys, that I had ever felt this good. Within the first 2 months, my infections went away. My psoriasis that I've struggled with my entire life, it went away. My migraines went away. I was losing the weight that I had put on with babies and was finding it more and more difficult to get off. My depression and anxiety went away, and I had energy. I remember the first day that I didn't feel like I needed to take a nap midday. I was so exhausted all the time, and I thought it was just from taking care of my little kids every single day, but it wasn't. I finally found out after so many years of suffering and really never being 100% what it felt like to feel awesome and have loads of energy. It was like I was a new person. This is when I discovered that there was something to this whole nutrition diet thing, and this is where my passion for holistic nutritional healing began. Where modern medicine had failed me, nutrition swooped in for the win, and I gained my own testimony of the fact that the food you eat can be the most powerful form of medicine available to us. Over the last several years, I've continued to study, research, and implement the things I was learning, and people began to ask me questions and ask for help with similar struggles that they were having. So I decided it was time to have some credentials beside my name so I could truly help people at a deeper level. This is why I decided to become a nutritional therapy practitioner and learn all that I could about root cause wellness, bio-individuality, and using diet, lifestyle, and some supplementation as a source for improving one's own health and quality of life. I do not diagnose as a nutritional therapy practitioner, but I have the functional and clinical skills to identify and support your body's own strengths and weaknesses. One of the first things I learned about in my nutritional therapy studies were the findings of Dr. Weston Price and Dr. Francis Pottinger. If you're not familiar with them or their research, put on those listening ears because this is crazy, awesome stuff. Dr. Price was one of the most prominent health researchers of the 20th century. He was a dentist who started noticing a change in his patients' teeth and facial structure over the years of his practice. He also noted a correlation between the dental decay, dental facial problems, and the other changes that had taken place in the Western diet. So he decided to go on a journey to research different cultures around the world who were still eating traditionally versus other cultures who over time had allowed Western food habits to creep into their way of eating. What he found was astounding. After his years of studying, he found that there are certain dietary laws that are inflexible and unchangeable. Also, that we must get fat-soluble factors from animal sources, and that in order to be healthy, foods must be properly prepared in their whole forms. He also discovered that all healthy cultures who continued to eat traditionally, or as their ancestors did, had several things in common. But before I get to that list of the things that they had in common, I want you to look at these pictures. Why are these people so healthy? These are some pictures. He has a book that he wrote, and these are some of the pictures of people that when he was in his traveling and studying and researching these people and their traditional diets and those who had introduced the Western medicine, or not the Western medicine, the Western diet, the differences. And so these are traditional people who were eating traditionally. And he says, native people eating traditional foods had physical excellence, splendid facial and dental arch forms, and no cavities. And this is kind of a blurry picture, but if you ever decide to read his book, you can see a ton of these pictures in his book, where he illustrates how beautiful these people are who are eating traditionally. And then here's some more pictures. So on your left-hand side, you'll see some people who have been eating traditionally. Beautiful facial structure, nice teeth. Then this is the Australian Aborigines. Then you look at those with the modern diet, and they had rampant tooth decay and modern diseases. And then the next generation from this, so we're like third generation down, right? Narrow faces, dental problems, modern diseases. All the modern diseases that we are now experiencing in our culture began to be more prevalent in this next generation, this third generation down. Actually, this is the second generation down from the modern diet. Okay, so what were Dr. Price's findings? He discovered that all healthy cultures who continued to eat traditionally had these things in common. Number 1, no refined or denatured foods. Number 2, they used some type of animal products, both raw and uncooked. Number 3, their diets were 4 times higher in calcium and contained 10 times the amount of fat-soluble vitamins as our modern diet. 4, seeds, grains, and nuts were soaked, sprouted, fermented, or naturally leavened. 5, fat content varied from 30 to 80% of total calories, but all diets contained nearly equal amounts of omega-6 and omega-3 fatty acids. Number 6, they all contained some salt. And number 7, they all made use of bones, usually as broth. And do you want to know what Dr. Price's greatest disappointment was? That he could not find a vegan culture that was truly healthy. That's just some food for thought for you. Okay, so let's talk about Dr. Francis Pottenger. He is if you hear about Dr. Pottenger, you might hear about him like this: Pottenger's cats. He did a study in nutrition. He did a multi-generational study on cats. He purposely fed one group of cats diets that were all cooked and nutritionally deficient, and the other group he fed raw and nutrient-dense foods such as raw milk, cod liver oil, liver, brain, heart, and muscles. He observed the decline and degeneration of the cats with the poor diet over several generations and noticed that by the third generation of cats, they exhibited very poor health, including infertility, structural deformities, allergies, lethargy and weight gain, easily agitated and aggressive, anxiety and ADHD symptoms, cancer, and often simply a failure to thrive due to poor health. The other group of cats stayed in great health and did not degenerate from generation to generation. The parallel was then made by Dr. Pottenger that what happened to these cats is happening to us right now. I love this quote. It says, "If it's true with human beings as it is with cats that nutritionally caused degeneration is passed down to our children, a sobering challenge stands before us." We are upon our third generation of living off of the standard American diet, or the SAD diet in quotation marks. And look what is happening to our culture. We can see a lot of what we saw in the findings of Dr. Price and in the findings of Pottenger's cats. We are spending trillions of dollars on healthcare, but we're getting sicker and sicker. Obesity, diabetes, heart disease, and cancer are all at epidemic proportions. Our children are plagued with ADD, ADHD, autism, depression, anxiety, and a host of other behavioral problems that were very rare back in the 50s. The Center for Disease Control is predicting that 1/3 of the children born after the year 2000 will become diabetic in their lifetime. If we allow this trend to continue, we are in for a tragedy of unimaginable proportions. In fact, the CDC's prediction that these children will actually be the first generation in modern times that will have shorter lifespans than their parents. This is truly frightening and sad. The good news is this, that in Pottenger's study, he was able to reverse the degeneration in the cats by changing their diet back to the nutrient-dense one, but it took 4 generations rather than the 3 it took to get to that state of degeneration for them to regain full vitality and health again. So it proves that it takes a little bit longer, more generations, to get back to health than the length of time it took to get to that point of disease and degeneration. So what does that mean for us? That we can reverse this trend, you guys. Not only can we reverse it, but we have to reverse it. So how do we do it? First, it begins with you and me. You're listening to this webinar for a reason. You care about your health and the health of your family, and you want to do what's right. You want to be healthy physically, spiritually, and mentally. If you didn't, you wouldn't be here. So yes, we need to begin with ourselves and our families. We need to be a force for good in supporting the paradigm shifts that need to be made in our current culture. That might sound really big, grandiose, and overwhelming, but it needn't be. The paradigm shift is happening, and we're hopping on the train at just the right time. So what do we do? What can we do right now to support a more healthy and nutrient-dense diet for ourselves and for our families? Here's a simple macronutrient breakdown followed by a simple to-do checklist. Don't feel like you have to tackle all of this at once. That could be really overwhelming, and it's not about perfection, it's about progress, making small and simple changes now that over time will lead to big change. So start with one item, from these lists that I'm going to be giving you, and just pick one at a time, and when that one thing becomes a habit, move to the next. When it comes to diet, there's no one size fits all, and you'll also find a ton of contradictory thoughts and philosophies on diet and nutrition, but these recommendations are in general good practices for most people. And remember, it always comes down to you experimenting and finding out what works best for you and for your family, and something that you can feel good, feel your best physically, spiritually, mentally, and maintain as a lifestyle. And that's going to look just a little bit different for every single person. So let's start with a breakdown of our macronutrients. Here's our carbohydrates. In general, 40% of your diet should come from carbohydrates, mostly vegetables with some grains and legumes. Choose low glycemic veggies that are raw or lightly cooked. Eat 2 to 3 whole fruits each day. For your occasional starchy carbohydrates, choose whole grains, potatoes, brown rice, those kinds of starchy carbohydrates, the good ones. And then 15% of your calorie intake should come from those starchy carbs. Buy organic, local, and seasonally as much as you possibly can. I understand that there are instances where it's not always possible. So again, just do the best you can and don't feel stressed out or overwhelmed. if you can't do everything perfect, and if you can't buy everything organic, locally, and seasonally. Do the best you can. Protein. 30% of your diet should come from quality protein sources. Choose grass-fed, wild meats, organic free-range poultry, whole, raw, cultured dairy, organic lamb, organic free-range eggs, and low-toxicity seafoods. Again, I'm just going to say it over and over. You do the best that you can. Try to make simple, progressive steps to eating cleaner, more healthy sources of protein. Fat. 30% of your diet should come from quality fats. We're going to talk about fat in a later webinar, so I'm not going to go into a big detailed reason why we need to get off of the low-fat train and eat a lot more quality, healthy fats in our diet. So I'm just going to go over what I have written here, and we'll talk more about fats later. But you need to choose raw and or soaked nuts and seeds, raw cold-pressed oils from nuts and seeds, cold-pressed extra virgin olive oil, and good saturated fats from healthy sources such as quality butter and coconut oil. So next, I have a list here for you. This is a simple, short, non-toxic list or diet or practices based on the Nutritional Therapy Foundations and principles. And then after this webinar, you will have access to a PDF, and in the PDF I have a longer list. So basically in the longer list that I'm giving you in this PDF, it breaks down some of these steps that I have listed here for you in more bite-sized chunks, little pieces that you can do one at a time. So it's a longer list, again, not meant to be overwhelming, but I wanted to give you the resource so you have something so that you can continuously be working on something, continuously work towards becoming a little bit better with your diet and your nutritional practices. So here's your simple, non-toxic diet and practices based on the Nutritional Therapy Foundations and principles. Number 1, eat organic foods whenever possible. Drink filtered water. 3, rotate foods, especially common allergens such as milk products, eggs, wheat, and yeast foods. Number 4, eat natural, seasonal, and local food as much as you possibly can. 5, cut out processed and packaged foods as much as possible. 6, include fruits, vegetables, whole grains, legumes, nuts, seeds, and some full-fat quality dairy, as well as fresh, wild-caught fish, organic free-range poultry, grass-fed red meat, and wild game. 7, cook in iron, stainless steel, glass, or porcelain, and avoid or minimize caffeine, coffee, alcohol, and nicotine. So that is your list. This is a simple non-toxic diet and some practices for you to start implementing into your life. So what I would encourage you to do is to download the PDF using the link that I've provided with this webinar, and please print out that more comprehensive list and pick 1 or 2 things that you would like to start working on now to start changing the nutritional habits that you have for yourself and for your family. You might get a little resistance at first with your family, but it's okay. Over time, you know, when they're adults, they're going to come back and thank you. And trust me, I get it. I just switched over to raw milk, and I'm getting some resistance from my teenage boys, but I'm going to find ways to sneak it in, and over time, it's just going to be a part of our life. And that's what I suggest to you. Small daily steps over time. It will lead to change, less resistance, and you're going to be healthier yourself, and your family is going to thank you for it later. So I hope that you enjoyed this webinar number 2, and I hope that you take some action with these action steps that I've given you, and I am excited to talk to you guys in our webinar number 3 all about digestion.